In a recent tour of Mustang schools, I was impressed by the very detailed system that Superintendent Bradley and his team had in place. But I was also sad to hear growing concerns about students in jeopardy of graduation because of poor academic performance and falling behind academically in their school. Quarantines have caused great disruptions in schools and in classrooms, despite our best efforts. For this reason, the State Department of Health rolled out a new voluntary policy this last week that allows an asymptomatic student who has been exposed to COVID-19 inside the classroom to quarantine, again, quarantine in classrooms instead of at home. To be clear, if a student tests positive, they are isolated and not allowed back at school. This is only to do quarantining in school. The pilot program will run from now until December 23rd, and we will be closely monitoring the data from these students. We'll be testing them at this school. We've chosen to test them daily during that time in order to give us some very important data that no one in the nation has right now. I believe that this will be the first school in the nation to do a program like this, and it's a very proud and big moment for us. That data will help us inform decisions as we move forward regarding how to keep our children safe and how to keep them in schools. We feel confident that this pilot will further our understanding of disease transmission within the classroom and protect our students effectively and keep infected students and teachers from entering the classroom setting. It's an innovative way to safely keep kids in school so they can continue their academic studies, and will give us more data to drive our response to the virus.
This is a very big day for Oklahoma's children. The top priority for the governor and I has always been to protect the lives of every single Oklahoman. We also know that it's important to keep businesses open safely and to let our students go to in-person school. That is why I'm so excited today that the Oklahoma State Department of Health is partnering with education leaders on this pilot program. I want to thank Superintendent Bradley and Mustang Public Schools for leading the way on this, and I hope more school districts will soon join them. Back in the spring, we were just learning about how this virus would affect us. Today, we have much more data on how the virus affects children, not only physically, but also mentally and emotionally. We know that kids are missing out on important social interactions that come with being at school in person. We know that child abuse and neglect cases are going through the roof. And they're unreported because children are not under the watchful eyes of teachers and administrations at school. We know that some students are being left behind. As Dr. Frye mentioned, they don't either have the technology or the support they need for remote learning. And we know that children are also struggling with the mental health as a result of prolonged isolation. The CDC reports that starting in April, children's emergency room visits for mental health issues have gone up significantly, and they're still at very high levels today. It's clear that in-person learning is best and safest for all of Oklahoma's children. The director of the CDC recently said, schools can operate with face-to-face learning, and they can do it safely and responsibly. He also said, K through 12 schools are one of the safest places that children can be. As we work together to slow the spread, I am glad to see that our health department is finding ways to balance the health of our students and teachers with the importance of in-person education.
What I want to say is obvious. We are educational professionals. What we do is educate. We are not health professionals. That is where, since the beginning of coming back to school in the midst of the pandemic, we have relied on our partnerships with our local county officials. Jan Fox has been tremendous. Without her support in Canadian County, I don't think we could have made it this far without having that close contact with them. So I appreciate everything that they've done to help us out here. So with that, being educational professionals, relying on the health professionals, having this pilot program here in Mustang would allow three goals as defined. The first one is the health and safety. If I've said this before, if the health and safety box is not checked, then we don't go to the next step. And so since this is a pilot program developed by the health department, then they have gone through those safety protocols that would make that environment safe for students who have been in a close contact situation to be quarantined. And so the second thing is it provides flexibility for schools, and we know this policy is for any school district to participate in, so the policy has to be somewhat encompassing to allow for a large school district as well as smaller school districts to participate in it. So it allows flexibility for part of our campus to be used for these in-school quarantines. And then the third thing it does, since that part of that guideline is the daily testing, we're choosing to do the daily testing, it gives us an idea of what those positivity rates would be with students who've been quarantined in a school setting. So those are the three goals that we looked at and saw that was being provided by the health department. And so we took those and we thought, how can this work here in Mustang? We chose the high school because we're already on an A-B setting. And then from there, could we identify a location to house the students who, and again, this is a voluntary program, that no student is being forced to or being asked to be part of the program. It's voluntary. We just provide the environment for them. And so we identified an area in our school that has its own entrance and exit where the students can enter in, and we have an area where students would be tested. And then once the tests are coming back negative, they're a rapid test, then they would be allowed to go into the learning environment, which is a classroom located next to it. So we identified those areas that could be of ease for students, and then also far enough away where there's no interaction with other students who would be on the campus. Then the other part of that is staffing, and that's where we are right now, is trying to identify an adult to supervise the setting. And what we started with, since this is a new program, we wanted to make sure we were educating everyone about what is this pilot program about, what is it not about. And that way people can have an informed decision whenever they're looking at, do they want to be a part of this or not. So looking at those three goals, identifying a location and identifying a adult supervisor for this environment are really what we're looking at here. We are looking forward to collecting any data that would help us for our long-term goals of providing face-to-face instruction on an ongoing basis. So that's our ultimate goal.
I'm excited to be here in Mustang today to support this district's and our state's efforts to get Oklahoma students back in the classroom. As a teacher, I know how important it is for students to be able to connect with their fellow classmates and their teachers. Learning happens best in the classroom. We have thousands of amazing teachers across our state I know are anxious to safely be back with their students again. We have to heavily consider the academic ramifications of students not being in school in addition to their health outcomes. Both are very important. I have anecdotally heard from students and parents and teachers across the state who are talking about how far behind our students are falling. We have to be safe, but we have to get our kids back in school. Their future successes depend on that. I appreciate Superintendent Bradley for thinking outside of the box on how we can keep kids safe and how we can keep our students in school. I hope to see other school districts follow Mustang's lead, and I look forward to seeing the data that this pilot program will provide as we continue to make decisions in the future.
As we learn more about this virus, we will continue to adapt our recommendations. In addition to this new in-school quarantine policy, we know that the CDC is adapting and changing its guidelines on quarantining as well. We plan to follow the CDC's guidance to reduce overall quarantine from 14 to 10 days if the person has no symptoms, and to allow those without symptoms to test out of quarantine after day 7 or beyond if they have a negative test. We believe these changes will help improve quarantine compliance and help further slow the spread of the virus. We're also working with pharmacy statewide to provide free saliva testing to add to the already robust test capacity in our state. We know that cases are increasing, and though a vaccine is coming, I can't reiterate enough the need for Oklahomans to be vigilant right now and to continue to do the right thing. This is a contagious virus that's rapidly spreading throughout our communities. We must not grow weary of protecting ourselves and our loved ones. Please wash your hands, watch your distance, and wear a mask.